Good afternoon. I'm John Bitson, the Menard Family Director of the Sheila and Robert Challey Institute for Global Innovation and Growth. I'd like to welcome you to today's panel discussion on reclaiming human flourishing when faced with a pandemic. The discussion is jointly sponsored by the Sheila and Robert Challey Institute for Global Innovation and Growth and NDSU's Department of Public Health. I'll be moderating this discussion along with Dr. Pamela Jo Johnson, Chair of NDSU's Department of Public Health. We're pleased to be joined by three experts who approach this issue from three very different perspectives. First, we have Dr. Ali Mokdad. Dr. Ali Mokdad is Professor of Health Metrics Sciences at the Institute for Health Metrics and Evaluation and Chief Strategy Officer for Population Health at the University of Washington. Prior to IHME, Dr. Mokdad worked at the U.S. Centers for Disease Control and Prevention. He has published groundbreaking research on local level disease trends and leading risk factors for poor health. His work on obesity is among the most highly cited in the field. Welcome, Ali. Thank you for coming. Second, we have Dr. Lynn Blewett. Dr. Lynn Blewett is Professor of Health Policy at the University of Minnesota School of Public Health and Director of the State Health Access Data Assistance Center, a multidisciplinary research and policy center that provides data analytics and policy analysis to inform evidence-based health policy. Professor Blewett has an MA from the Hubert Humphrey School of Public Affairs and a PhD in Health Services Research and Policy from the University of Minnesota. She has state and federal health policy experience, having worked as a legislative aide in health policy for the US Senate and was the health economist for the state of Minnesota. Welcome, Lynn. Thank you for coming. And then finally, we have Dr. Stefanie Haeffele. Dr. Stefanie Haeffele is Senior Fellow with the F.A. Hayek Program for Advanced Study in Philosophy, Politics, and Economics, and the Deputy Director of Academic and Student Programs at the Mercatus Center at George Mason University. Prior to receiving a PhD in economics at George Mason University, she completed a Presidential Management Fellowship where she worked in emergency and disaster operations at both the Federal Emergency Management Agency and then at the U.S. Forest Service. Her work examines post-disaster community recovery as well as the political economy of nonprofit organizations, specifically focusing on organizations that attempt to provide affordable housing for the poor. Welcome, Stefanie. Thank you for coming. And we have over 250 people attending today. Thank you all for attending. I want to note that the last 20 minutes will be reserved for questions from the audience. So please put any questions that you have in the Q&A feature of Zoom. Without any further delay, let's start the discussion. And so I'd like to turn it over to Pamela Jo Johnson. Thank you. Pamela Jo.
You're muted, Pamela.
Way to start. Good afternoon, panelists. We'd like to open today's discussion by asking you to each briefly tell us what has been your main research focus during the COVID-19 pandemic, and how does it relate to the theme for today's seminar, which is, how does society reclaim human flourishing when faced with a pandemic? Lynn?
Yeah, thank you so much. And it's a pleasure to be here and such a great audience. And thank you for inviting me. You know, our work, we've been, you know, our work has been primarily monitoring health insurance coverage and access to care, which the data is, you know, always like a year out of sync. And so we kind of scrambled around in March and were able to provide some funding to add on to the NORC survey that they do. They do an omnibus survey that's constantly rolling, and we added on a survey, a COVID survey, to ask about, and this was in mid-April, to ask about, you know, how people were doing. Did they lose their jobs? Did they lose their coverage, health insurance coverage? And then what they were spending their stimulus money on. And then we also asked about priorities of, like, when the vaccine comes, who should receive the vaccine. So we're, you know, it was kind of a baseline, and the value of it is kind of maybe outdated now. We'd like to follow up, and but everybody's kind of scrambling in terms of you know what's happening in for individuals, and there's a couple surveys in the field right now that the Robert Wood Johnson is funding, and we're hoping to do, you know, to add on to that survey, that the COVID survey we did with the NORC panel.
Ali.
So good afternoon, and thank you for having me. Our work started on COVID-19 at the request of the University of Washington Medical Centers. We have several hospitals here. One of them is a major hospital and a referral hospital for the region. And of course, as you know, we had the first case and first deaths in this state, in this city actually, from COVID-19. So they asked us to prepare for the surge and project for them how many beds they need, ICU and ventilator, in order to prepare. And when we started doing this and doing the projections for our county and the county, next county north of us, the catchment area for the hospitals, other hospitals came along and asked us to do the same. And eventually we started releasing projections, including mortality, number of infections projected, needs for hospitals, bed, ICU, and ventilators for every state. And now we do it for every country in the world.
Thank you. And Stefanie.
Thank you, and thanks for having me here today. I'm excited to get to speak with everyone and learn from the other panelists. Pre-COVID, my research was primarily focused on post-disaster community recovery, and particularly with hurricanes. And so after COVID hit, we were starting to see some of the same lessons that we had learned from natural disasters and the disasters we've studied before happening with COVID, even though it's very different, right? Where we're kind of extended in, you know, it's not over yet to reassess and figure out how to recover, but we're having to figure out how to sustain while we're here. So in order to do that, we've completed a couple of surveys that have gone through IRB at Mason, and we use through Qualtrics for adults in the United States, asking them questions about what are the burdens that they're facing, how have they stayed connected with family and friends and other social ties, what's changed with work, school, and other areas like that as well. And also getting a sense of, you know, are they having an issue finding goods and services? Do they feel like their networks have been hurt, or have they been able to communicate with one another and kind of make plans and kind of get at some of the same types of questions we normally do when we go into the field and interview survivors of disasters that are in the process or have recovered after a disaster. We're particularly focusing on some themes that we've identified in previous studies: the role of local leaders and entrepreneurs to fill the gaps needed of issues that come up during and after a crisis, the role of social ties and social capital, and what does that mean when we can't see each other face to face and we have to shift online, the idea of essentialness and how do we update that in real time as well. So we're digging into a lot of those questions. Our next thing that we plan to do is a more segmented survey looking at decision makers in businesses, nonprofits, and government to kind of see how they've had to shift, what barriers are they facing, and how are they addressing changing needs in the pandemic.
Well, thank you all again. We have a lot of, again, a very diverse panel, and I think we're going to get some really good perspectives. We know that work is very important to us psychologically, culturally, and socially, and it promotes meaning in our lives and general well-being. Furthermore, we know that a loss of work is associated with poor mental health. It's also associated with poor physical health and increased risk of disease and mortality, and decreased overall well-being. And so, Lynn, you studied the economic challenges faced by those who have had work reduced or lost. How can we address those challenges?
Well, we're watching the impact of COVID on the loss of employment, and in the U.S., most of us get our health insurance through our place of employment. So it's kind of a double whammy to lose your job, and then the potential of losing your health insurance coverage at a time when healthcare is so needed. So, and you know, it's a concern when we don't have universal coverage in this country, and we have a very piecemeal patchwork system of safety net for those who lose coverage. So, you know, for states who have expanded their Medicaid programs, which is 38 states plus the District of Columbia, and have an advantage in that they have, you know, a pathway for those who have lower incomes to get coverage. Also, those states who have state-based exchanges, there are 15 of those, they also have an advantage as they've been able to open up their state-based exchange during mid-year to offer people who have lost coverage to sign up. So, you know, it's the flexibility of being able to, as a state-based exchange, to offer that coverage and that pathway to coverage. And then to think about how can we reach those who are in states that don't have those same advantages. And again, the Medicaid expansion under the ACA and the marketplace, subsidized marketplace plans are really our core safety net for health insurance. And those we need to shore up and think about those states who have not expanded and what can we do for those people who don't have access, who've lost their job and lost their incomes.
Okay, thank you, Lynn. And Stefanie, you've studied some of the ways that we can encourage and support work during the pandemic. What are some of the ways that we can do this?
Great, thank you. So first of all, I think the pandemic hopefully shows a lot of what you said already about what matters for work. And in the field of economics, that's not always how it's studied. So one of the things I've been really interested in is this sort of kind of strict economic view of labor, and what it means to really think about all of the other impacts, social and mental and others that are a part of work. So I think that more robust view of work is helpful for researchers to have a more holistic or interdisciplinary approach. One of the things that we looked at kind of early on in the pandemic was all the changes that were happening and quick changes about sort of the assumptions we have about work, particularly in the US. And so, you know, there are a lot of jobs that we have, you know, traditionally said you have to go into the office for are now remote, and how do we adjust? A lot of unemployment and what do we deal with, like Lynn was talking about, and how to help in those areas. And also this idea of a reconception of essential, right? When we, you know, a lot of jobs that we would have thought, or ones that, you know, a parent might not want their kid to do, or we look down upon, are actually incredibly crucial and valuable. And how do we think about that? So some of the things we've explored and talked about is this embrace of technology and innovation, and how in this time being as flexible as possible, if you can, for an office is important. And there's a lot of jobs in the United States in particular that can shift remote. And you know, being an academic or a teacher, we're learning that right in real time as well. But how do we really think about those, and how can we kind of reassess what to do? And so you're seeing, you know, these combating things of, you know, we can collaborate over Zoom, but we might have Zoom fatigue, and how do we address these issues? So being open and flexible and allowing for technology and innovation to kind of happen in this space is helpful. The next is this idea of respecting essential work, and, you know, being able to reassess the types of jobs that that are important and that should be supported. And the other is to find ways to assist workers, and particularly unemployed workers, during the crisis. And so how can we utilize those programs both at a federal and state level, but also community-based programs? Particular industries started to you know, find ways, like you know, distilleries and breweries were finding ways to support people down the chain, their supply chain, like bartenders and restaurant workers. So how could we utilize and really encourage all those types of aspects is something that I think is important. And hopefully, as economists, we begin to put some of these other factors back into our analysis when we're thinking about labor.
Okay, yeah, thank you, Stefanie. And Ali, based on your expertise as a population health expert, are there ways to address the loss of work in a way that balances infection and other risks?
So I totally agree with what both my colleagues said, and the issue with universal health coverage becomes now more important than ever before. And when we look at employment right now and the loss of employment, there is an immediate impact and there is a long-term impact. And long-term impact is delaying of healthcare needs, and people who have right now, and we're noticing that there is more demand on mental health right now. We see it in our telemedicine at the University of Washington right now. And we know from previous history, when there are more depression and anxiety, somebody who's smoking will tend to smoke even more. People tend to gain weight, less likely to take their medication. So there is a long-term effect. How we can rebuild is, now we're discussing all these stimulus right now. First, in my opinion, is universal health coverage is a priority for this country. We're the only country who doesn't have that. And also to maintain our ability to look at disability in this country and what's ailing us, and not only what's killing us. And we haven't done a good job at that. How could we do it moving forward? Is addressing socioeconomic factors, making sure everybody has access to quality medical care. Right now, even people with insurance. I live in Seattle, I'm next to a good hospital. That's not true for somebody on the east side of my state. Even if they have the same insurance I have, they don't have access to quality medical care. And the most important one is addressing preventable risk factors. Is how could we as a country, as we rebuild, to not leave anybody behind. And right now we're all focusing on response, but we need to sit down and plan recovery, and then make sure as we roll back jobs, don't forget the long-term impact, and not saying, oh, people are getting back to their jobs, but there are other things that we need to do, and the agenda has to cover all of those. Of course, now we learned the hard lesson, as Stefanie said, the health of our country depends on the health of the weakest among ourselves. And we learned the hard way that people who are keeping our country running and keeping food on our table are more likely to get diseases and more likely to die from COVID-19, and we need to protect them.
Okay, thanks, Ali.
So next, let's talk about various experts disagree on whether policies and solutions to the economic, health, and psychological consequences of the pandemic should be focused on federal government and centralized solutions, or more local and decentralized solutions. Stefanie, you've argued that decentralized and localized solutions are more effective. Can you give a brief explanation of why we should look for more local solutions instead of centralized federal government solutions for the pandemic?
Great, thank you. So I've studied, particularly community recovery after disasters. And in that space, when you have, particular communities that are hard hit, their particular circumstances and context and needs can be quite different than other places. And so I think the importance of remembering the role of local community leaders, entrepreneurs, and citizens is important in any recovery plan, to really get at the particular needs that are at that community. In our book, Community Revival in the Wake of Disaster, we look at Hurricane Katrina in New Orleans and Hurricane Sandy in New York. And we found that local leaders and entrepreneurs, and by entrepreneurs, we don't mean just business owners, but social, political, and commercial entrepreneurs as well, sort of change agents in the space at the local level, are really important because they provide goods and services that are needed for their community. They might be able to do so faster or as a supplement to federal assistance, particularly after a disaster when it might take a couple of weeks for the National Guard and the Red Cross and federal forces to come in and help. But they also connect goods and services from donators, government, and other suppliers to those in need. They also restore networks, particularly disrupted social networks. And so after Hurricane Katrina, people were displaced. It was hard to communicate and figure out which neighborhoods were coming back. Now we have a different sort of network disruption, but those locals being able to adjust and make ways to communicate with each other and come up with a plan for how to respond is important. And the other one is that it's really the local leaders and entrepreneurs and your neighbors that signal recovery is on its way. And so despite what we're, or in addition to government action, it's only when that's being implemented and you can see the results of those funds or assistance that you really have the sense of, we can recover and rebound. And that's a interesting one to apply to the current context, because we're kind of trying to sustain and rebound in the middle of the pandemic. And so how we see that the leaders of our children's school or church or business or the place where we go and get dinner when we are sick of cooking in every night because we're not going out places, those are really like kind of signals that like, oh, there is some sense of normalcy, there is commitment to our community. And so for those reasons, I think even it's not just necessarily instead of, but in addition, those community leaders are really needed to, kind of help get community buy-in and really funnel resources to what's needed most.
Thank you. Lynn, as someone who represents the federal and state policy perspective, are there some types of solutions that really need to be implemented at federal or state levels?
Yes, and I would say that there's like a critical need to pass another stimulus package. It's just so critical that it happened, and if it happens before or after the election, I just think as soon as possible. The state response is limited by how much resources they have, and states have to balance their budget every year or 2 years. Most are on a 2-year budget cycle. And with the economic downturn in the economic activity, they have less revenue to meet the needs. And so when you think about a state government, all across the country, states don't have enough tax revenue to support their programs and are already thinking about cuts for this, for fiscal year 21 and beyond. So we're talking about cuts to education, K-12 higher ed, cuts to transportation, cuts to, the healthcare sector, which takes up about 35% of a state budget. So the federal government plays an essential role. They have deeper pockets, they can borrow money, and I know we're digging ourselves into a deficit, but it's just critical that we have another stimulus package, and not only to support individuals and small businesses, but an amount to support state governments to continue to meet the needs of their local communities and core safety net programs. Because right now, there's 8 to 10% cuts across the board in terms of public programs at the state level. So it's a critical need for the federal government to step up. The states can't do it on their own.
Thank you. Ali, what is your perspective on centralized and/or decentralized solutions?
So public health is local, in my opinion. And if you look at the United States right now, and we've published these studies, when you look at, take one measure of health, let's say life expectancy, and we look at life expectancy in the US, there is a huge variation between states. And when you look at counties, there's a huge variation between counties. So take female life expectancy. We have counties in the US that have one of the highest life expectancy in the world, higher than a Japanese woman, than a woman in Singapore. And we have counties in the United States where life expectancy is similar to what we see in Africa, way low than Lebanon, where I was born. But when you even go into a community like a county, and take my county, King County, Seattle, we did that at the census tract, and we found 18 years difference in life expectancy within the county. And this is one of the richest counties. I mean, we have Amazon, we have Boeing, you name it. So public health is local because the ingredients or the deck of cards is dealt differently for every community. And in order to make a long-lasting improvement in health at the community level, you have to involve them, and they have to be part of the solution. And that's very important. So you have to take into account the local variation in risk factor, access to medical care, socioeconomic factors. But at the same time, that doesn't exclude a strong national response. In COVID-19 is a good example. A national response saying national mandate for masks, we would have saved a lot of lives, for example. Rather than leaving it up to every state and every county, and there was confusion with a mobile community. I have family and relatives all over the US. It's so confusing as my cousin is doing something different in his community than what I'm doing in my own community, and we're the same family if we're talking like this. So both are important. And in the United States, we have to enforce the national laws that, and we have to take a leadership in national response, clearly in COVID-19, but at the same time, because we have so much diversity in our community. The last point briefly, public health emerged from medicine. And in medicine, the word experiment is not acceptable. We don't experiment in treatment. We have clinical trials, and then we go into procedures or drugs. But for public health, when it comes to community, the word experimentation is very important. We have to try new innovative solution at the community level, working with the community. I mean, like a program to reduce obesity, a program to improve diet. We have to do these experiments, and we have to pay for these innovations, and we have to encourage these innovations in order to achieve the goals that we all want in this country.
I'd like to ask a question from all three of you. We know that the shutdowns can be effective at slowing the virus and in reducing the number of COVID deaths, but we also know that economic decline is a public health crisis. Many businesses have permanently shut down. There have been record levels of unemployment and declines in economic activity. People have suffered emotional and mental health effects from isolation, and there have been deaths and declines in physical health from social isolation, the inability to work, and the delay of necessary medical care. Are there less blunt mechanisms to slow the speed of the virus than the shutdowns? In other words, mechanisms that would have fewer harmful effects? And I'll leave it up to let's ask Ali your perspective on this one first.
So very true. We've seen it. MMWR, CDC published an article showed that immunization in April and May was much lower than the months before. So people are delaying medical care, we know that. Shutdown is a bad word, and it's really costly because you have a long-term impact. Right now, one of the most predictive of health and future health is what we call socio-demographic index at IHME, our global burden of disease. It's a measure of course, GDP, income, and fertility and education. And I can predict a lot of health conditions based on SDI. So it's very important when you lose your job, you're gonna impact your health, your well-being, a lot of other things as well. So we, in the United States, we put ourselves in a position that it's choice between two extremes. Either we shut down or we go about doing our life the way we used to do. And that's not acceptable. We didn't find a middle ground. It was politically divided, quite honestly. We're a political institution, all of us here academic. So we put ourselves in that position. We could have kept our economy running if we were wearing our mask and staying away from each other, if we provided everybody in the United States with a consistent public health message, clear, why you need to wear a mask. This is a deadly virus. It's going to be with us for a long time. It's not a flu. It's not going to go away. We could have done much better right now. And we, in the United States, the biggest example is the first peak that we have seen here in April. Remember, all states peaked out. Some of them got hammered because they didn't know COVID-19 arrived. They shut down. They brought it down. We were going in the right direction. We opened prematurely. So we didn't do it seriously here. We didn't follow up. Where other countries in the world, our competitors, did not shut down, but they did public health message, and they hammered the same public health message, no division. They were able to keep the country running. Look at South Korea, for example. Look at Japan. Look at Singapore. Dense populations like us, they kept running because the public received the same public health message, and we did it right. Right now in the United States, unfortunately, you are left with the only solution is shutdown because people are not adhering to this message. We can have, we can have it both ways, or we could go in the middle and do it the right way. So that's what we are right now. No, shutdowns are the last option. Give public health a chance, give scientists a chance.
Thanks, Ali. And let's ask Lynn the same question.
Well, it isn't my area of expertise, but I would just say that the United, and just to echo a little bit of what Ali was saying, is that the United States is at a disadvantage when we don't have a universal health insurance coverage and we have such a disparate multi-payer system where we don't have a consistent message. We don't have a consistent message through our healthcare system, and we don't have a consistent message from the federal government from a public health perspective. And so it's very difficult to have a uniform response. When you have a universal coverage system, you have the ability to track across all populations. You have the opportunity to have a unified message. And so, we just come at this from a great disadvantage. Sometimes our multiple, approach to healthcare and our competitive environment is an advantage. But in this case, when public health is such a core, one of our core strategies to addressing COVID, we're just at a disadvantage.
Okay, thanks, Lynn. And then Stefanie, what do you have a perspective on this?
Great, thank you. Yeah, I definitely think the challenges for, what solutions and are there a middle ground definitely were politicized and, it kind of quick, immediate shutdowns rather than trying some other options to echo, I think what Ali was talking about. I think on my end, I think the thing that is really challenging is the pandemic has a lot of uncertainty based around it. And so uncertainty isn't something we'll be able to remove completely, but the signal noise around government policies and what they mean and will they be revoked or changed, I think has really done a damage to figuring out how to kind of sustain and respond to the pandemic. And that's kind of happened across the board, right? Like protocols on mask wearing and now utilizing that as sort of a way to rebel against all the other restrictions that we have is really challenging. There's an issue with, sort of even the idea of the phrase social distancing. What does that mean? It makes it sound like we're not allowed to interact with anyone, where maybe physical distancing would be something that could, not sound so. So even kind of the branding of those things, I think, can have a big impact. And I think the other thing that's really challenging too is that, even though particular states and localities might need to approach safety differently based on the needs and population and risks, this idea that we think everything's shut down, we don't want to leave because we're we're at risk or we don't know the policies that are in place, has had sort of a widespread effect on how people know what to do. And so, we are looking at, what states said were essential services that could still run and which ones weren't, and what people thought they were. And there was so much uncertainty or so much change around what that was, that it's really hard for us to even know and predict what was labeled something we could do versus not. And so I think that sort of signal noise around the policies and the politics of that has put us at a real disadvantage, and it's going to make that harder to get through the next few months, right? Because people are frustrated and confused and, kind of over a lot of the things that come along with that sort of approach.
Okay, thanks, Stefanie.
So my next question is to the whole panel. The COVID-19 crisis has underscored the profound social, economic, and racial disparities in job reductions or job loss and consequent unmet needs, access to healthcare, COVID-19 infection rates, especially due to essential workers being disproportionately poor and non-white, and COVID-related morbidities and mortality. So how can we as a society find solutions to both population health and economic recovery that ensures all of our citizens, especially the most vulnerable, have the opportunity to flourish? Stefanie.
Great, thanks. So from my end of thinking about this from an economic and political economies perspective is a couple of things. I think one, the pandemic and the protests and police brutality right now are showing there's a lot of tensions and issues we need to address, and that we need to think about vulnerable populations. I think one major thing to do is to acknowledge that government also struggles with this as well. And so if we're frustrated with how we see our society responding, the most obvious solution of saying the government will fix it, it might be the one to proceed, but that there's going to be challenges there as well. We have a history of housing policies that were designed with potentially illiberal motivations that we're trying to deal with now, and other challenges like systemic racism and other issues. And so I think any kind of response going forward needs to have some good discussions about what that means and how do we best incorporate all of these ideas into not just government, but also our interactions in commercial and social life as well. And so kind of that focus less on, we just need to fix the problem and this is the solution for it as a system, but more of an approach that looks at how do we think about human dignity across all sectors and realize that there's people and institutions in every sense that have real challenges with these issues.
Okay, thank you for that. Lynn.
Yeah, so it's so interesting, the different perspectives on the panel. And, I'm always looking at, well, what levers are there at the state and federal levels, or even at the county level, that we can use to address whatever situation is at hand. And I think, I'm thinking, after listening to a little bit to Stefanie, and kind of a public health perspective is, how do we think about community? And if a pandemic doesn't get us to think about each other, I don't know what does, because, we're all in this together, and we get it from other people. And so it's so important to use a public health lens, which is to think about the population and population health, as opposed to maybe a more individualist approach to the world, which is such a strong part of our country and a strong part of our history. But that the community perspective and how we think about community and who is in our community is just so critical to moving ahead. And right now the politics are so polarized that we can't seem to get past a basic discussion. But I think it's critical that we do, and maybe this pandemic is shining a bright light on where those where those divisions are, and then the impact those divisions have, which are a spread of a pandemic. There are 30 million people who don't have any health insurance coverage. So if they're sick or have any kind of symptoms, they're not going to go in. They can't afford it. They don't know where to go. And so then they have to go to the store to get groceries. And maybe they're one of those people who don't believe in masks. Well, that's how it gets spread. And so, I think it's reaching down and thinking about maybe, the neighbors and your community and our state, and how we move forward as a population, as a community, and who is our community, and what does that look like? And I would just offer that, we're all in this together.
Thank you, Lynn. Ali.
So if you step a little bit back in the United States, when we look at our health performance, whatever measure we take, we do poorly, especially when compared to rich countries. And when you look at how much we spend on health, we spend almost half of what the whole world spend on health. And then look what we are getting. So we need to, in this country, to come back to the reality that there is no silver bullet here. We need to invest in socioeconomic equity. And we need, of course, to have a universal health coverage that's focused on primary health care in order to be preventive and deal with the risk factors. So basically right now, we hear some of our politicians, they tell you we have the best hospitals in the world, the best medical care in the world. Yeah, that's true for people who can access it and live next to it and have the insurance for it. But also at the same time, we need to change the notion of a good hospital and good medical care to include involvement in prevention in the local community. So that's very important. But let me give you an example on socioeconomic equity when we talk about the United States. Talked about the diversity and disparities in life expectancy, but let's talk about education. We all know that people of color have less years of schooling in this country. But when you look at quality of education, which we call learning at IHME, based on national tests or state tests, the gap is even wider. And in the United States, justified so, we focus on like when you have a degree, PhD or MD or bachelor, do we have equitable hiring in the United States, which is, we need to focus on that. But at the same time, we spend less time discussing why we have this huge variation in educational level at the high school level, at the college level. What are we doing about it? And let's be very specific here. We know certain schools, where I live here in Seattle, the school has much more money than another school in South Seattle. So how much per head a school is getting for taxes? Should we look at the median here and say everybody below that median should get help from the federal government? Result-based financing will give you the money, but you have to perform. And if you don't perform very well at the community level, with all our respect to you and your community, we should take over this school, public school, and maybe get you some help in order to get the right education for the people at that level. And we start early. We need more discussion about this. I agree with Lynn, we need more discussion about universal health coverage, but there is no single solution. We have to look at it in a comprehensive way. And COVID-19 told all of us, hey guys, you're doing it wrong, please reconsider.
So we've talked about a lot of the negative impacts from the pandemic. There's potentially some positive things to look at as well. And so the pandemic has had negative health, economic, and social consequences worldwide. There could also, though, be some positive side effects resulting from new ways of doing things by necessity. For example, Zoom and related technologies may allow for increased workforce flexibility and the ability to collaborate over larger geographic areas. And increased use of telemedicine may allow increased access to medical care in rural communities. Are there other effects from the pandemic that may prove to be positive for society in the future? And I'll ask, let's start with Lynn first this time.
Well, I don't know what the positive effects. I think maybe it's the realization that these pandemics are out there and that this won't be the last one. And so what we can do to think about the mistakes that we've made and how to better prepare is maybe a positive. Like, this isn't going to be the last, pandemic or catastrophic event we have, but it's certainly maybe not the best example of what we've done. So it's taking into consider, looking back and saying, okay, what could we have done, and what would be a better approach, and having, being a step ahead of the curve next time this happens.
Okay, thanks, Lynn. And I'll ask Stefanie, do you have some positives from this?
Great. Yeah. So I definitely agree with Lynn that hopefully something that comes out of it is sort of, like, if, we can get through it, we can prepare better for next time. Somebody who studies disasters, I realize I'm thinking a lot more about go bags and preparedness than a lot of my students or colleagues that don't. So the fact that, kind of everyone's impacted might change that a little bit. I do also, though, worry that, particularly compounding disasters have even a more complicated toll on people, economically, socially, mentally. And so what happens when particularly, some populations who have been in crises for a while, this is now added on top. So not a positive, but a way to counter how we've been thinking about it. I do think, though, that hopefully the flexibility and innovation and reassessment of things can be helpful. And so, does this make it easier to have remote staff that aren't living in the same place and collaborate? Because we now know we can, it might have been really annoying before on a phone call to have, somebody working from home and their dog barking, but now we all have it, and I'm petting mine right now so he doesn't whine while we talk. And so that kind of flexibility and adjustment of expectations for work might be really effective, particularly when, the balance of all our obligations and responsibilities are a lot. And I also think the innovations that have been happening are useful, like, the way restaurants and other places are adapting, the way we're getting, groceries to vulnerable, like to everyone. So an elderly person who's worried about the risk more than others can go early or get it delivered. I'm hoping that those are helpful, and that maybe some of the, regulations or restrictions on occupational licensing that we're seeing maybe lax a little bit during this might stay forever. And that could be really helpful for particular people, particularly in, some of these industries that, the level of training and licensing they need is probably hindering people being able to work in them. So I'm hoping that that's a bit of a positive that we can learn from some of these as well.
Okay, thanks, Stefanie. And Ali.
It's very hard for me to say there is anything positive about COVID-19, and I agree with both of them. My colleagues, if we learn our lesson and we change our approach to public health and education, maybe, but I'm not that optimistic here, unfortunately, because we've had many chances throughout our history in the US to do it right, and we decided not to. We don't have universal health coverage after those how many years. We debate health more than anybody else. We talk about it more than anybody else. And look at our performance. So hopefully, we change our approach. Hopefully people will realize that science is very important. Investing in science is very important. Public health is very important. Investing in local public health is very important. But I'm concerned, John, as you mentioned, Zoom and other stuff, this will increase disparities in the United States. And this will put us in a much worse position than what we started with COVID-19. 15% of Americans don't have access to high-speed internet. and these are the poorest that we really need them to get the better education, to be healthy in order to do better. And we have to realize in the United States, when we say we need our country to be on the top and the best in performance when it comes to economies, we need to invest in our human capital. We need to invest in our working force. We need to invest in their education. We need to invest in their health. And I hope this will change and will be a wake-up call for all of us. Then there is something positive out of it. But unfortunately, I don't see it yet.
Okay, thanks, Ali.
So next, nationwide, there have been different approaches to reopening schools. Approaches have ranged from completely in person to completely online to some combination of the two. On the one hand, many are concerned that remote instruction may be harmful to children and teenagers' futures, particularly those from disadvantaged families. On the other hand, others are concerned about teachers being at risk. How can we balance the need to protect people from the disease against potential negative effects that remote learning may have on kids' long-term futures? Ali.
I was born and raised in a poor farming village in Lebanon. The road came to my village when I was 10 years old, and electricity came like 1 year later. Piped water came to my village when I was already in college at the university. So I know firsthand what it means when you say education is very important. If it wasn't for education, I wouldn't be here. Education is very important. And yes, in class, I am a teacher as well. So in class, it's way better than doing it online, and especially with the disparity about access. So I'm for opening school, but at the same time, making sure that in the neighborhood where you live, you have controlled and you've done your part about COVID-19. You want to open your schools, close your bars until you have, bring down infection. Then you can consider opening non-essential businesses, in my opinion. So we have to do the whole package. Opening school is not a debate. Keeping them open should be the focus of all of us. So that's what we really need to focus on. Otherwise, we need to protect our children. And then from the epidemiology of COVID-19, the infection used to happen early on, the outbreak investigation, when we do tracing, it used to happen mainly in bars and restaurants, gathering outside homes. Right now, as we move into winter, in many states, especially in the northern part of our country, many of the outbreaks are at homes. It's not coming from schools anymore. It's coming from in-home parties, people getting together indoor. We feel safer as a human beings. We feel safer around people that we know and we trust, family and friends. They're not going to hurt me. So we let down our guard, we take our mask, and we don't keep away from each other, safe distance. So we need to open our schools, in my opinion, but we need to do it right. We need to control the virus in our community, then open our school, perhaps a hybrid, cut down the number of classes, make sure we provide a decent meal for people who need it in our school, and we give them the best education.
Thank you. Stefanie.
Great, thank you. Yeah, I definitely think kind of figuring out how to focus on children and find a way to keep things open with restrictions rather than kind of the default of being no, with trying to make things work is important. Often children are viewed in analysis of a disaster or a crisis as incredibly vulnerable, and for many reasons they are, but they're also resilient and interact with adults and each other a lot more than we sometimes include in the analysis. In the disaster recovery literature, some sociologists, and particularly Lori Peek at the University of Colorado, has done a lot of studies on children and how they're a little bit more complex than we might think. And I think that matters for thinking about what should they do if they can't go to school in person. Are there extracurriculars or smaller group sessions where they can interact and socialize? And what do we do if it is really challenging for particular students that don't have access to internet or the equipment at home to do so? And then the other thing I think that matters too is the importance of what it means to have your children in school and educated, and what that means for being able to work, and the burden that's being put on parents to help with that, as well as try to do their jobs too. And so after a disaster like a hurricane, if schools don't reopen, people might not rebuild their homes because they have to handle, do things for their children or relocate to a place where it's open. And so how do we think about those connections too? And so I think for all those, it means, paying a lot of attention to what's happening and trying to come up with some good solutions.
Thank you for that. Lynn?
Yeah, I think the responses have been good. And I would just add that, our public school system is such an important part of our safety net. It's a way to reach kids, not only for education, but also for their nutrition and their food. And it's one of the only ways that we touch a lot of these kids. And so, the priority just has to be to address school and how to access these kids, and especially the lower income populations in the inner cities or out in the rural areas. This is our future, these kids, and it's so important that become a priority. And I am concerned about, it falling to the bottom of the list. So the kids then the public school system should be top priority when thinking about closing things down or limiting it. We should try to keep them open as much as we possibly can, but also, follow the science and the experts on when and how to do that.
Thanks, all of you. I have individual questions for all three of you. So first, Stefanie. So you argue that entrepreneurs can contribute to an economic and social recovery from the pandemic. What have you learned from your research on the ways that entrepreneurs can contribute to an economic and social recovery?
Great, thank you. So as I mentioned previously, our past work on disasters looked at how entrepreneurs tend to fill three roles after in disaster recovery: providing needed goods and services, restoring networks, and signaling that recovery is on its way. And one of the things we found in sort of initial research and observations for the pandemic is that seems to be holding true as well. And that kind of concept of entrepreneurs is something that we use a little bit more broadly. So they're commercial, but also social and political as well. And so, we've seen sort of the adaptability and way that entrepreneurs are trying to adjust to the needs that are changing as we go about. So, there's a lot of businesses that shifted to trying to help with mask production and other PPE equipment and ventilators. That kind of shift in need can be really helpful. And we no longer, there's still some goods that are hard to find, like Clorox wipes or something like that, but we've overcome a lot of the supply chain shortages the first couple of months of the pandemic. Similarly, providing an element for social networks or a social space matters quite a bit. And in this setting, that makes it a lot harder. And so, seeing how churches and gyms and music teachers and other people have adapted to, one, bring people into their homes via Zoom or other things like that, but also, finding ways to utilize outdoor spaces and the challenge that brings now that it's starting to get colder. And also that just kind of like commitment to community, showing that recovery is on its way. It can mean a lot to know that, even with all of the uncertainty that's going on, if you have a strong superintendent in the school system that makes some promises to a community and follows through, that's going to say a lot to show that there's a commitment to make things work. So that's kind of where we found those kind of key drivers really show a lot to help people make ends meet. And then that often hopefully gets translated after the disaster as well. So sometimes an entrepreneurial venture like a new coffee shop in New Orleans after Katrina is useful then, but maybe can't compete afterwards once there's kind of maybe new and better coffee shops that come up. But there's also a lot of lessons people use as they adapt and get to know their communities. So I think that has a long-term impact too.
Okay, thanks, Stefanie. Lynn, you argue that the United States needs a stronger safety net to deal with events like the current pandemic. What have you learned from your research on how a stronger safety net can contribute to an economic and social recovery?
Yeah, so I guess I've mentioned the safety net several times, and maybe just a little bit of a definition is, and from a public health perspective, the safety net, for healthcare are public hospitals, our community health centers, our federally qualified health centers where you can get free care, community hospitals that provide care for the uninsured. So there's kind of a patchwork of systems, like if you get sick, there's a place to go. But the safety net also is really critical for a time like now with an economic impact of this coronavirus, and linking our health insurance to our employment has really showed this in great light. And so that safety net becomes not just for the uninsured and poor, but it becomes people who have lost their jobs and lost their employer-based health insurance. And that's what we have a safety net for. So Medicaid and public hospitals, and especially the Medicaid program works like in a cyclical fashion. So when the economy is doing well and jobs are growing, fewer people rely on the safety net or the Medicaid program. When we have an economic downturn like now, Medicaid serves as a solid place to go to get coverage, or now our marketplace plans, which provide subsidies. And those should be considered kind of a core fundamental part of our healthcare system when we don't have a universal coverage system. So if we're willing to tolerate as a country 30 million people uninsured with no health insurance coverage, we absolutely have to provide avenues for low-cost care, discounted care, free care, and subsidies to provide for services. And not only for individual health, for children's health. We've seen now with this pandemic, the immunizations of kids going down. People are fearful of the cost of care. And so, you know, it's either we have universal coverage and commit to that, which I don't see in the near future, or we provide enough avenues to get the needed care, and whether that's sort of in a way that I don't know. I guess I just feel like it's an important part of our healthcare system that we often neglect, and we often don't want to talk about or elevate or think it's only for poor people. It's not just for poor people. It's for people who are in low-wage jobs that don't provide health insurance coverage, for startups, artists, kids whose parents are immigrants. You know, there's just a whole range of people who are as deserving as the rest of us to have coverage.
Okay, thanks, Lynn. And Ollie, I have a two-part question for you. So through your work with the Institute for Health Metrics and Evaluation, you have been a widely quoted expert on modeling the anticipated pandemic trajectory and predicting needed hospital bed surge capacity. First part is, how has this work contributed to protecting the public's health and in contributing to policy development? And then what lessons have you learned through this process, both from successes and from failures?
So our models have been widely used for the surge preparation, and which has been very helpful. And also early on in our projections, we put when you can move from to a containment phase from the lockdown. Some state, followed, some state didn't. So I think also the president at that time delayed opening the country for 2 weeks. So has helped in that regard. When people listened to science, it worked. That's the first part of the question. The second part of the question, what we are learning from this kind of work is a dynamic. Change is the constant, and people change their behavior when they see in the news. Unfortunately, in the United States, cases are going up. They start wearing more masks and they start reducing their mobility. And then cases start coming down, they change their behavior, and then they go back to what they used to do. So we learned that we don't have all the data that we need in this country, even with such an emergency, that we don't know how many, some states, we don't know hospitalization rates in these states. They don't release the data. And the behavior of the public has been unpredictable in many ways, unfortunately, due to the confusion that has been because of the lack of a national mandate and leaving it up to everybody else. But the most important lesson here is paying attention to socioeconomic factors is key. And everything we do right now, that has been a stronger predictor of everything we see. And, geography is also destiny in a way, where you live And unfortunately, in this country, the color of your skin makes a big difference as well. So we've seen a devastating effect on Hispanic community in this country, on African community, on people of color. And we see it much more among Hispanics, unfortunately, in certain places, and among African American and other places as well. So safety network, as Lynn has mentioned, and business to do their part, and on the long run to help with the rebuilding. But also one point I'll add to both my friends is we need at this country health promoters at the local level. When you see it in other countries, it does miracles. And imagine in this country, if we had COVID-19 and we had this concept of health promoter, who knew in a community who's the elder person who needed care, you need to go and buy their food in order to protect them and keep in touch with them. Could we create a mechanism for volunteering here? We have many good people who want to do the right thing in this country. We don't have a mechanism to tell people how you could volunteer, how you could help your neighbor or your own community. Lots of things that we can do in order to improve health here. But again and again, socioeconomic equity is key in this country. And unless we address it, we will be having the same discussion years from now.
Okay, thanks, Ali.
So next I have questions, again, for all three, looking toward the future. So I'm going to jump back to you again, Ali. And based on your continuing work in this area, are there policies that could be implemented that would help in dealing with future events like this?
Yes, in several ways. One of preparedness, of course, to make sure you're ready for such an emergency. And we've learned, like I was at CDC when we had Katrina, our emergency plan for Katrina, we learned a lot of lessons at that time. And I published how we could be better prepared, because our preparedness was not geared around non-communicable diseases. We had preparedness plan around infectious diseases. And then we were not ready for mental health and disability. We were not ready, for example, at that time where you had a older lady or older gentleman telling you, I take the white pill in the morning. Go figure what pill it is. So we could do better by preparing in this country, in the United States, in order to be ready for another event. Unfortunately, in this country, there was a preparedness office by President Bush and President Obama. So it was bipartisan. It was basically abolished when this administration came. So we have to be ready for preparedness. And also, as Lynn and Stefanie have been saying, the social network, the safety, and the universal health coverage with a focus on primary health care. This is the lessons we are learning right now. These lessons from a public health standpoint, what I'm telling you today is not new. We've been saying this all. Lynn has been saying this for a long time. Stefanie, I don't know her as much as I know Lynn, but I'm sure been saying this for a long time. So it's time for action. It's not time for talking, it's time for action.
Thank you for that. Lynn, based on your work and observations of other countries, are there health and social policies that could be implemented that would help in dealing with future events like this?
Yes, there are. Whether they will be is, as Ali said, probably not. And but there's a lot of things we could do. And if we're not going to have a federal universal coverage program, there are a lot of states that are almost at universal coverage, support states in moving towards expansion, providing the financial mechanisms and the flexibility at the federal level to allow states to do public option or buy-in, or there's a lot of really interesting ideas about how to get more people covered. And again, in lieu of a universal health system. What we've learned from other countries, and Ali has mentioned this, is that they provide universal health insurance coverage, but the base and the foundation of that coverage is primary care, social supports, and it's not all the high-tech, super expensive hospital, catastrophic care. It's really bread and butter healthcare and public health, immunizations, screening, help with your newborn baby. It's really bread and butter and so important and critical to the future of our country. And then if we don't have a federal response, then we have to look to the states and the local level to sort of what can we do locally to achieve some of these objectives without a national, a national vision and approach to solving some of these problems.
Thank you, Lynn. Stefanie, based on your work on recovery from disasters, are there policies that could be implemented that would help in dealing with future events like this?
Yeah, thank you. So kind of echo what everyone said so far, yes, and really kind of learning from past disasters and trying to stem the uncertainty and signal noise that happens in current disasters is a huge focus that I've taken in how to think about these things. And so, I've talked a little bit before about, the added uncertainty and what Emily Chamley-Wright, a scholar that's worked on some of these issues called signal noise. And so, when we're talking about a stimulus, but it might happen, it might not, maybe it's off the table till after the election, right? All those sorts of challenges, I think, makes it a lot harder for people to change their behavior based on expectations of what's going to happen. So, after hurricanes, similarly, the less plans that are needed and tweaked are the better, because eventually we stop paying attention to the plans. The other thing that I think is important is to take lessons from some of the rules that we're relaxing or that we adjust after a disaster. And so if there's a new rule we put in place, but also ones that we get rid of, well, maybe we could have those on the books so that we know that happens immediately. And that might be easier said than done at community and state levels, but I think that would be helpful at the federal level as well. And really kind of connecting that idea of preparedness and mitigation with what happens when we're responding and recovering. When I worked at FEMA, I was on the preparedness side, and there was a lot of good work happening, but was it utilized every time there was a disaster, or when was it thrown out the window? It was a challenge and tension. And so how are there ways that we could make that easier on ourselves the next time around would be really helpful.
We have one last question from Pamela, Joe, and I before we start going to the audience questions. So the last question I'd like to ask all three of you is, Tyler Vanderweel, professor of epidemiology at Harvard, has suggested a potential method for determining the appropriate policy during the pandemic. And this approach is called a total lives saved approach. The approach would be to utilize evidence from previous studies on the effects of things like unemployment, social isolation, and depression on mortality risk, along with evidence of the effects of pandemic policies on economic, social, and psychological outcomes to estimate total lives saved or lost from all causes of death. So not just from COVID, but from all causes of death as a result of various lockdowns, social distancing, school closing, and other policies. And I'm wondering if the three of you have thoughts on the feasibility and value of this kind of approach. And so last time I started with Ollie, and so this time we'll have Lynn go first, and then I'll ask Stefanie, and then Ollie.
I would just say that we do have a lot of evidence from a lot of scholars in different areas that could be combined to think about what's going on. I just think, it's a multiple pronged problem we're dealing with, which is, economic, mental health, employment. And if we could think about, holistically about the impact, that would be great. I also would say that it's difficult to do. And in, studying cross-country comparisons, we use, DALY's disability adjusted life years, which is trying to understand, like, how can you compare a life in Lebanon to a life in Minnesota? And you try to equalize, well, how do we compare across those two countries by using a common metric, which, has its pros and cons, but so I think there will be scholars who work on this. I think probably not in the short term, but it's something when you're, again, kind of moving from that local level of what is the problem we have to address today versus, how can we understand this from a bigger picture in terms of metrics and measurement. It's a good question. I don't have the answer, but it's certainly something that people have considered and will talk about for many years to come.
Thanks, Lynn. And Stefanie, I'll ask your perspective on that.
Great, thanks. Yeah, so I think it's definitely an interesting approach and can cover a lot of the sort of unseen effects of a pandemic rather than the most easily seen. But with any stats and indices, there's going to be issues with doing that. And so I think it's a very ambitious approach. Like you could imagine you trying to figure out, how many deaths occurred because somebody didn't go to the emergency room when they, might be having a stroke or something like that, or what's the impact of domestic violence during a pandemic, right? It gets really, really complicated to try to do, but I think it's a valiant effort. I'd say, the thing that I think about when thinking about the methods that we use in social science is just, we're going to need a bunch of them, and no index or stat is going to solve the problem for us. And we need a bunch of different things. So as an economist, we deal with generally a lot of statistics and indices and things like that, but I might be a weird one. We do a lot of field work. And so combining those sorts of methods are what's going to matter a lot when we try to, kind of learn from what's happened to prepare for next time.
Thanks, Stefanie. And Ollie, I'll ask your perspective on that.
No, there are 2 points. So yes, we will have excess mortality that we're not counting from COVID-19. And then we do this in every outbreak and every shock. We go back and revise our mortality upward or downward, and this will happen here. But to look at life saved only will be misleading because COVID-19 is not about deaths only. COVID-19 is causing mental health disability. So I agree with Lynn. We just published on Thursday the Global Burden of Disease 2019, so all the way to 2019, and disability right now are a bigger contributor to the burden of disease than mortality. We're doing a good job in every country in the world. In my opinion, in the US, we could do but way better in reducing mortality, but we're not doing a good job in reducing disability. And to focus on mortality from COVID-19 will be really a mistake because we need to see how much disability has increased. That's one. How much reduction in income and GDP, because that will impact health in the long run. So it's not about people who are dying, which is sad. These are family members, not numbers. These are friends and relatives, but it's more than that. It's about disability as well, and we need to look at the big picture.
Okay, thanks, Ali. So we have some questions that came in from people that are in the audience, and I'd encourage you, if you have any more questions, please submit them as well. So the first one is, this one's aimed at Stefanie, I guess, because it says Stefanie. It says, I love your phrase, commitment to community. What is community and who speaks for the community? There's other parts to the question. I guess I'll just continue. It feels like we have influential public figures whose messaging is actually turning members of the communities against each other during COVID. Who represents the community and can give people a feeling of being part of a community so that individual sacrifices are seen as social value? So I think all of us could answer or all three of you could answer this question, but let's start with Stefanie since it's aimed at you.
Great, thank you. Yeah, so I think kind of figuring out who is in our community changes. And so, how to kind of balance those conflicting messages from leaders, or kind of figuring out our own path is gonna change. So for many things, when we're looking at after a disaster that's hit a city, we're gonna look at neighborhoods, but also, what's the school district that their children go to? Where do they work? How do they interact? I think that's true with how we can think about it now. I think there is a big challenge with the fact that we're a really big nation that has a huge variance across it. And so what do we do when there's potentially national or kind of patriotic claims against maybe communities or those sorts of things? And so I think the biggest way to think about it is, there is no one voice for your community. And so, being able to question and think about who matters and who do you look to means a lot. And so I think there's a lot of different leaders and people that can step up, and figuring out the ones that you can rally behind in that time is important. So in New Orleans, there was a Vietnamese community where the priest of the Catholic Church was Father Bien was very powerful in getting people to recover. And so it was clear that he thought he was a leader, and the community did as well. But he was able to combat some of the things that were happening to their community in New Orleans, or things that were happening otherwise. And so you can kind of have those tensions. So I don't have a clean answer, but it's important to be thinking about who your connections are and who you're looking to when thinking about what that means.
Thanks, Stefanie. Ollie, would you like to answer anything with that question?
No, I think Stefanie did a great job here. The key issue is division. And if we are divided, the community then is divided. And that's the problem we are facing right now in the US. It's not the definition of the community, it's the division that we have to address. And hopefully, after the election, things will go back to normal. And it's okay to disagree, but let's do it in a right way. We disagree all the time about a lot of things. But that division has been stronger than what I have ever seen in the United States. And I've been here since I was 24 years old. So.
Yeah, thank you. And Lynn, would you like to add anything on that? Oh.
Not really, except that, leadership matters. And it's really important right now to have people in positions of leadership to use their bully pulpit and to support the science and support the public health. And a lot of times in our work, we get down to like, well, why did this happen? And at a, in a state policy arena, and there was, it's leadership, and it's a leadership to guide a decision and to bring people together. And it's a little bit, we say, I don't know, it's a little, we want it to be more, we want some other things to think about, but a lot of times in the policy world, it's just so critical that leadership at this juncture really matters.
Okay, thank you. So the next question is, can any of the panelists identify a policy enacted at the federal or state level to combat the pandemic that you believe was worth the costs? And can you describe why it was worth the cost? And so let's let Ollie answer this one first.
So mask wearing is a very good policy, and that's the best one that every state could do and should do. If you look at early on in the pandemic, the states that were, let me explain what happened here. We had a lockdown, all states in March, all of us went into lockdown, and they did different lockdown, rolled them out. Just to give you an example, when Florida had the lockdown for schooling, closing educational facility, mobility went down by minus 56%. So they had a different effect everywhere. But like when New York locked down, there was enough seeding in the community that cases kept increasing. The lockdown was the smartest things that New York did, and did it fast. So it depends what state did it, and one, it saved a lot of lives. For Florida, when it shut down, they didn't have enough cases, so they felt safe. And then they opened up prematurely, cases hit them harder. So mask would be my number one. Large gathering. Closing gathering has been a success story. I like that, and has worked very well.
Okay, thank you. And then Lynn, we'll let you take the second shot at this question.
Well, my perspective is health insurance coverage, and I would just say that the Medicaid expansion under the Affordable Care Act, which after a Supreme Court decision was ruled optional by the states, those states that have expanded Medicaid have provided, an essential safety net, and have, lower rates of uninsurance and access to needed healthcare. And so it's kind of a no-brainer why, one way to serve low-income populations of color, especially for those southern states where there is such a high rates of populations of color, that would be a mechanism that could be used to expand access to needed care.
Okay, thank you, Lynn. And then Stefanie.
Great, yeah. So I think, a lot of the, teasing out what were guidelines and mandates are tricky, particularly back then when we thought they would not last for very long. But I think, sort of a push towards being more flexible with work that could be, I think, is really important, and was something that was worthwhile. I also think a lot of some of the laxing of particular occupational licensing rules or other things like that at the state and local level has been really important for providing opportunities for people who have maybe lost a job or needed to continue with what they were doing. Flexibilities with restaurants and things like that have been really helpful. So I think we can't really look at all policies as being ones that shut us down or restricted our mobility, but both as we take into account.
Okay, thank you, Stefanie. Another question is aimed at, there's a comment made about another stimulus package. And the question is, if the federal government initiates another stimulus package, won't that potentially be detrimental to our economy? And I'll ask Lynn first on this one.
Well, we're deficit spending for sure, and that is not good for the country as a whole. That's one perspective. On the other perspective, we don't have much choice. People are suffering. They don't have food. They don't have work. They can't go out. It's part of us getting through this period. We, in the last recession, we had some stimulus packages, and it took us 4 or 5 years to come out of that recession in the early in the 90s. And so it's part of how the government has to adapt to the current situation. I don't know that we have a choice, and it's not something anybody wants to do, but we're a big country with a lot of resources, and we can and will recover. And it's just going to, I think it's essential.
Okay, thanks, Lynn. And Stefanie, I'd like to hear your perspective on this.
Yeah, great. So there's definitely always consequences that happen with any policy, and particular incentives that might shift. And so, it's true that a stimulus might mean that somebody might not have to look for a new job, or it delays that when we might, want to encourage getting back in the workforce. But I think there's a lot of challenges at play right now that we need to think about too. And so, if there are a lot of businesses shutting down, and there isn't a lot of, change opening up, like helping people during this time period matters. One thing we could think about is, how does that interact with other policies? So, while there could have been an incentive effect over the summer, where people maybe stayed home a little bit more than they needed to when looking for a job because they had stimulus money coming in. A big issue that we saw for policies was that it was actually small businesses that were trying to get loans from the government because they were also struggling, that had ties about how much employment they had. And so if they had furloughed somebody, and they would need to get that back on their payroll in order to get certain loans. And so those contradictions between policies might actually have more of a effect than just the economic incentives of helping out during this time. But I definitely think kind of, assessing how all those interactions take place matter. We often are kind of coming up with solutions as they're implemented. So we know there was a bunch of challenges with sort of the initial stimulus packages. So how do we do that a little bit smarter, and also aware of how these policies might contradict, I think would help.
Thanks, Stefanie. And Ali, I'd like to hear your perspective.
I agree with Lynn. We don't have an option, and the cost of not doing it will be much higher than if we do it right now. And I agree, we're borrowing money from our children and grandchildren. So it's on us to do it right, and it's on us to do this one extremely good and not leave anybody behind in order to recover much faster.
Okay, thank you, Ali. Another question says, I was struck by Stefanie's comment about how our communication strategies could influence compliance with public health measures like physical distancing versus social distancing. And the question is there some similar issue with the way we talk about masks? So it's very relevant right now in Fargo. So we have a mandate, but there aren't penalties for following the guidelines. So is there an approach that we could use for messaging, instead of penalizing people for not doing it? So is there a way to message it, I guess is the question. So Stefanie, since it was directed at your comment, I guess I'll ask you first.
Yes, I feel like I definitely will defer to some of the public health experts that probably know what the messaging should have been or should be in the future. But I do think the way we talk about these things, the meaning we put behind them matters a ton. And so when we're feeling really restricted, all of a sudden, we might feel it might increase our feelings of isolation and frustration. And so I definitely think the notion of social distancing kind of aligns with that. Like, I have students that, are talking about how, our social ties are gone or we're not allowed to communicate. And it's like, well, that's not entirely true, but you could feel that way for sure because everything's harder. And so I think that idea around masks is, the messaging around masks changed a lot over the past few months and has been politicized. And so I think finding ways to, talk about sort of all the ways it's helpful, I think is good. I think now, even if somebody might agree with the branding, there's other things attached. The meaning is now more political than it was before. And so that's going to change the way we think about it. And so, in the type of economics we do at Mason, we look at some key thinkers in the Austrian School of Economics. And one of the things that they say is the facts of the social sciences is what people believe and think, which, we want the stats and all the things like that, but how we interpret it matters a ton. And so I think that's really important.
Okay. Thanks, Stefanie. So Lynn, do you have ideas for how to message?
Not particularly, but I was interested in Stefanie's concept of signal noise and how there were so many different signals about masking at the beginning, including Fauci, who's saying early on that you don't need to wear one. So I just feel like, the need for uniform messaging, leadership that based on science, and then having a plan about how to message is so critical. And I think, having just so many different things going on, creating this noise where people don't know, it continues. And so again, the leadership, consistent messaging, and starting with the based on science.
Okay, thank you, Lynn. And Ali.
I mean, this is not new for public health. We have dealt with it before with seat belt, with condoms. And I was at CDC running BRFSS when the injury center had to publish a paper saying that in state where the law allowed a policeman to stop you for not wearing a seat belt, you're more likely to be wearing a seat belt. I mean, this has been before. The messaging should be consistent, and we should be patient, not to blame people or shame people who are not doing it. We need to make it rational why it's very important to wear a mask. And I come back to the point that Lynn made. WHO and others early on said no need for the mask because we didn't know much about the virus. When this became a reality that masks are very important and we should wear them and they will protect us, the message should have changed and been focused on science, and science should have been come and clarify why we changed it, why we're asking you to wear a mask where before we said don't wear a mask. And it was because early on, I personally didn't buy a mask because I felt the medical team need to get the mask, so I was making my own one at home. Right now, we have masks available, so everybody can wear them. So we should have been very clear on the message. Political division doesn't help. And the last point is, again, a political role model. When you have people in the leadership not wearing a mask and saying masks are not important and making fun of people who wear a mask, that doesn't help. And also the last point, when you have some people right now, they call themselves scientists. In my opinion, they're not scientists, and say masks are not good for you or will hurt you, and it's not reducing the transmission of the virus. That's criminal, in my opinion. And then we should deal with these issues, and we should tell the public, level with the public. Americans are smart. Tell them the truth, then do the right things. It will take time, but we will get there.
Okay, thanks, Ali. I'd like to thank all three of you for participating in this panel discussion. I think it's been a very interesting discussion. We get three very different perspectives. I'd like to thank Dr. Pamela Jo Johnson for co-moderating with me as well. I also want to mention, I have to put in a plug for our next event. So we have an event on November 3rd where we have Arthur Brooks, the former president of American Enterprise Institute, a conversation with him I'm really looking forward to that conversation, and I hope that you all join us for that November 3rd at 3 o'clock. And that's the first of our Menard Distinguished Speaker Series. And so please join us for that. Come to the Chali Institute's website and you can sign up for it right now. So thanks again to all of our panelists, and let's all give them a virtual round of applause. So thank you very much, everybody, for attending, and thanks for the good session.